Thank you. Okay, thank you very much for those introductions. So what we'll do is we would give you, if you need all of it, say 30 minutes to take us through your presentation or submission, and then after that I'll allow the members to ask questions if at all there will be any questions, and then we'll be done. So we can start. And also just to mention that we are live on Parliamentary Radio.
Thank you, Chair. Chair, pursuant to Standing Order 166 of the National Assembly of Zambia, Standing Orders 2024, the Committee on Health, Community Development and Social Services considered the sector estimates of revenue and expenditure for the financial year 1st January to 31st December 2026. The committee was tasked to scrutinize two heads, namely 1. Head 45, Ministry of Community Development and Social Services, and 2. Head 46, Ministry of Health. In undertaking this task, the committee held 8 meetings during which it interacted with the respective ministries, 14 grant-aided institutions, and various non-state actors. Honorable Chairperson, our report is presented in 2 parts, each highlighting key findings and recommendations. Under Head 45, specifically pages 15 and 16, the committee notes that the Ministry of Community Development and Social Services has been allocated 9.7 billion in 2026, representing a 2% reduction from 2025, largely due to the conclusion of drought response measures. Of this amount, 7.6 billion or 79.1% is directed to the social cash transfer sub-program, reflecting disparities that risks neglecting child welfare, disability affairs, older persons, and public welfare assistance. The committee therefore recommends that government should rebalance program investments to strengthen the broader social protection system. Mr. Chairperson, the committee further observes that efforts to link social cash transfer beneficiaries to the National Health Insurance Management Authority, NIMA, covered only 20,000 of the 1.5 million targeted households. The committee therefore urges government to set clear targets and provide budgetary support to extend NIMA coverage to all beneficiaries. Chairperson, under 46, Head 46, the committee notes that the allocation increased by 13% from 21.5 billion in 2025 to 24.7 billion in 2026. However, its share of the national budget declined from 10.7 to 10.3%, falling below the 15% Abuja declaration target. Donor support also fell by 10.9% from 3.2 billion to 2.9 billion. In this regard, the committee urges government to increase domestic health financing and improve spending efficiency. As detailed on pages 34 to 36, the allocation of 2.5 billion to NIMA was deemed grossly inadequate. With the ministry's support, the committee recommends varying this allocation to 5.2 million. and further proposes ring-fencing sin taxes to ensure predictable funding for the health sector. Chairperson, while allocations for medicines rose from 5 billion in 2024 to 6.4 billion in 2026, operation costs should reach 8 to 10% of the total drug budget, with increased investment in last mile distribution. The committee also calls for an addition 1.5 million to the National Health Research Authority to enhance research on traditional, complementary and alternative medicine. This investment is long overdue, considering the health dividends association to traditional medicines. Further, the committee urges that recruitment of health workers be doubled from 2,500 to 5,000 in 2026 to reduce the 46% staffing gap. Further, the committee calls for prioritizing the recruitment of community health workers for equitable service delivery and coverage. The committee also recommends that nutrition funding be raised from 19 million to at least 40 million to activate the UNICEF match funding opportunity. This additional funding should be realized from a supplementary budget, noting the inadequacies in the allocations to health. Chairperson, furthermore, the committee underscores the importance of strengthening tax compliance to enhance domestic resource mobilization, to reduce poverty and inequality, and improve health outcomes across the country. Chairperson, I submit.
Okay, thank you very much for that submission. Vice Chairperson for the Committee on Health, where we are looking at the two heads. Honourable members, any questions? Honourable Mabenga.
Yeah, thank you, Chair. I'm trying to just understand on one. I've got one area of clarification under Ministry of Health. We recently bought some new ambulances. I'm trying to find out where these ambulances, the maintenance budget for these ambulances. I can't find it where this thing is, because it's important that these new ambulances are kept on running. And the other areas on the cash for work. Also, I can't see where that budget is. I don't know whether it's on that one, which line that is, and whether there's also need to review the operation of this cash for work, because to me it's an area where the money just being drained if it's not properly managed. Thank you, Chair.
Thank you very much. Any other questions, honourable members? Are you able to respond to his question before I...
Honorable Chinkuli, you can answer.
Okay.
Thank you so much, and I'm sorry for having coming late. My name is Honorable Chinkuli, Member of Parliament for Kanyama and a member of this committee. I just want to look at the issue of the maintenance aspect of the ambulances. Though that was not actually looked into critically, but what was coming out was we're trying to learn from the way the police vehicles are being managed, where there's a directive that anything to do with maintenance of those vehicles should be borne by the institution itself. So I think looking at uniforming the system, the Ministry of Health will automatically look into the maintenance of the same. and not under CDF. I submit.
Thank you.
Just to add on that, also we have also it's also in head 46, where is it head 45? Community development. It's under local government. So I think they will do something to make sure that the ambulances are taken care of.
Thank you. Honorable Member of Parliament for Kantanchi Zedni Wengwa. Yes, sir.
Thank you, Chairperson, and thank you, Committee on Community Development. I want to draw your attention to health workers. Your proposal to double what the government has proposed. Now, you are going to agree with me that even with what the government has proposed, this is going to be a strain on the fiscal space, especially money, resources that are supposed to go and support other socio-economic activities in our country. Your committee, why hasn't it gone further, maybe to propose to government other cheaper sources of employment? You have internships, you have apprenticeships, where these workers are actually not on full government payroll, but they are surviving on a reasonable wage bill, but at the same time, not voluntary. Voluntary, it means they're not being paid anything. But where they are working, but at the same time, as the economy continues to grow and create opportunity, eventually these are the same people who get employed, they go through interviews and so on. Because creating 2,500 more is not only a drop in the ocean, but it will be a strain on the fiscal space of the government. As a committee, would you look into something like that? Thank you, Chair.
Thank you. Honorable Mijelo.
Chair, thank you very much. Vice Chairperson for Health, we thank you very much, and we want to thank you for your presentation and your responses. Chairperson, I have a very serious concern on the issue of ambulances, and the member for Kanyama here, when he was responding, he did respond also about on the issue of police vehicles. I think it's quite very important, Chairperson, for you to know that the police vehicles, I think maybe 40 or 50% of police vehicles are already in bad shape, and maybe 50 or 60%, and they are not serviced. I think out of 156 police vehicles which were procured under CDF, I think very few have been serviced. Most of the vehicles are not serviced, and that is our money, and that is people's money. And those vehicles are for our communities who we serve, but we have left them in the hands of the police officers who have no capacity to service those vehicles. And as I'm speaking right now, I think all the honorable members, I think, can attest to this, that the police vehicles are in bad shape, and as I'm speaking right now, they are not even serviced, Chairperson. Then if we also neglect these vehicles under Ministry of Health, which are saving also our people, and they are saving lives, including the police vehicles are saving lives. And these also under health, these ambulances, they are saving lives, our own lives. But it's like we, the honorable colleagues, I think we have neglected this issue, and we must own it ourselves, because those are our vehicles. And let us pay extra attention, that we make sure that the money, honorable Chairperson, the administrative fee, it's quite very enough. administrative fee, we can manage to save those vehicles. And it is we, the members of parliament, who we should make sure that those vehicles are serviced. We can speak to our council chairperson, because they are bought under CDF, and those people, they have no capacity to tell you the truth, including the health, including the health. And you know, look at the ambulances, they look like. Those vehicles from the districts, they are in a very bad shape. So please, I think it is this committee, we should come up with a serious recommendation that let us look after these vehicles. It's ourselves who bought those vehicles. Let us look after them. Thank you very much, Chairperson.
So that was more of a comment on the Honorable Simunyi. Your mic, Honorable General Scholar. Then you will come after Honorable Simunyi, sir.
Thank you, Chair. My question is almost the same like Honorable Mumba on the recruitment of 2,500 teachers, health workers to 5,000 health workers. Now, when you look at this, even the 2,500 planned for by government, the recruitment comes with at a cost. These people are being recruited, they come with their own conditions. When you look at the budget for 2026, there's a deficit, meaning the government hasn't got enough money to fund all projects which are being planned for. Now, with an increase of another 2,500, have you looked at the healthy budget and maybe suggest which areas you think we can move money to go to recruitment? Thank you very much.
Thank you. Okay, that question is tied to Honorable Mumba's question, so let's take the last one before you respond. Question from Honorable General Scholar.
Thank you very much, Chair. Mine is on ZAMSA, Chair, just to find out from the committee whether this delay in funding is connected to the mismanagement that we've been getting on the operations of ZAMSA. There have been reports for quite a number of years now. I don't know whether that situation of mismanagement has been sorted out and whether this delayed funding is connected to that. Because this is a big issue in our country today, Chair, where a lot of stakeholders have really complained about this issue of medicines. Even the head of state is on record actually to comment on it. I wanted to find out from the committee whether they found out as they were sitting on the same issue. Chair, also, I just wanted, as a way of comment also, to try and rebut my young man across here who was talking about servicing of these vehicles from the component of administration. Chair, my investigation in my constituency reveals to the contrary. Chair, this administration component, before all of us here know, half of it is gone through workshops. And honestly, today we are talking about the police vehicle, we are talking about the monitoring vehicle, we are talking about the ambulance. I don't know, colleagues, whether you've taken interest to know how expensive it is to service or maintain the fleet of the road equipment that is already with us from that component. I want to agree with the Honorable Kasauta, really, that a situation which is bad, and in my committee we have the Zambia police, we discuss the same thing. But when you sit down and look at that administrative component, just the servicing of these vehicles or this fleet that I've alluded to, especially the earth-moving equipment, Chair, is impossible. What is important is maybe to find a way out. How do we look after this equipment?
Okay, I think what our guide is, we are
Maybe I'll
meeting
stop
the
there,
committee
Chair.
on the local government accounts on the 16th. It's a very important question. So keep a tab on that one so that we look at the topical issue at hand.
We discuss it in full.
But even on 16th, local government accounts is coming.
Thank you.
Keep a tab on that one. Vice Chairperson, who can respond to those?
Thank you, Chair. Honorable Chala.
Thank you, Chair. I think first let me respond to the last question about the ZAMSA. Why is it that they are receiving late, their funding is poor because of mismanagement? I think when we interrogated, when we had discussion with them as a ministry, they stated very, very clearly that I think on the mismanagement part, that is not the reason why there is a delaying in the funding. What we had discovered is that most of the officers that are working currently there, they are acting. 90% is acting, director acting, this one acting. Then we were also concerned, and probably because of we proposed that if the government could come up with a board, appoint a board which should superintend over ZAMSA, things might improve, but not because of mismanagement. Currently, we are told they have over 1.2 billion debt, ZAMSA. So it is very, very critical that as we are appropriating this year's budget, we should have that in mind, that any amount that might be released will be directed to servicing such debts for 2025. Coming to honorable member who asked about the servicing of the vehicle, I mean the recruitment of what we have proposed, ours is our proposal. We felt that if the government could recruit more community workers and be put on payroll, it will serve our community better. But we did not go further to interrogate the area of internship. Those are temporal issues, but we wanted something which should be permanent from the government, not temporal. Thank you.
Say this. Just to add on the recruitment of health workers, we said that we needed monies from other heads that could help the ministry to recruit more health workers. That's what we talked about.
Okay. Now, in doing that, did you put a specific amount, because that is your committee, and this committee, the expanded planning and budget, would want in fact to engage the minister with figures?
We didn't put the figures, we just the number of the workers.
The workers, okay.
That is 2.5.
Okay. Honorable.
Just to comment on a number of issues that arose in relation to the servicing of these motor vehicles. Indeed, I want to agree with the honorable members who are suggesting that we need to look at the administrative component under CDF. Honorable members, you may wish to take note that this component under CDF, if we are to interrogate it, you realize that it has not attended to the issues to do with CDF. The bigger chunk that has been used is on the movement of these council officers, where they're having meetings in Siavonga, Livingstone, Bala, and the like. When you come to the issue of disaster, it will take 1 year when you apply, and you find that disaster is gone. So it's indeed, important that we look at that 5%, CDF component, administrative component. Let us see how best we can vary it to certain more critical or important, aspects like such of, servicing of these, motor vehicles, and probably the other component, push it to. So right now, as we are speaking, they are thinking of doing away with the laptops which they bought using that component and getting brand new ones. We've gone around trying to investigate, and this is coming out actually. So it's just important that we look at that 5% component and probably try and assign certain tasks to it. Otherwise, I submit.
Thank you. You still have comments, honorable members? Okay, Honorable Mumba, Honorable Mabenga, Honorable Simunji, in that order. Honorable Mumba.
Chairperson, my issue here is that we have a problem. First of all, even employing 2,500 more nurses or health personnel will still not respond to the challenges that we have. If you look at the numbers that are going on the street in terms of graduated young people from health, from teaching, from all these other courses, these numbers that government is proposing to recruit are still not enough. And if you measure that against even the deficit that was referred to, as a committee, we are part of the global village. These, and we're all well traveled here, these recruitments or employment, there are different methods. And the reason I've raised this is because Honorable Chala called it casual. There are different ways in which you can still get to the numbers, but cheaply, at a cheaper cost. That's why I was saying, did you look at other methods of employment? Because even this number that we have, I intend to argue on the floor of the House that it's too little. But I will also argue to say I also know that we have a deficit. But can government also look at these other forms of employment?
Okay.
You can even copy from private sector. We have had, for example, I'm coming from mining constituency. The Mupane mine, as big as it is, it has got contractors. Those contractors are the ones that have employed people. Now, if you get the money that a worker who's working the contractor and the worker who's directly working with Mupane, all going underground, same they call it same lift, same job, but you find that these on the contractors are more than the main people work for Mupane. So I was saying, did the committee just look at other ways of employing and then answering to this, but cheaper for government?
Honorable Mabenga.
Yeah, thank you, Chair. My question is on page 34. The last paragraph, procurement of medicines, medical supplies and distribution. There are so many reports that government medicines, they find themselves in the private clinics or private pharmacies. I just want to find out from the committee whether this budget, which has increased from 5 billion to 6.4 billion, whether it includes branding of the government medicines, especially tablets, that whether they are written Gerazet or in the color or something like that, so that the thieves deter from pilfering these tablets. Thank you, Chair.
Thank you, Honorable Simunji.
Thank you, Chair. I'll still refer to the same question. When we were dealing with our colleagues from public accounts, they were talking about varying funds from LUA to ACC, and they came up with a figure. Now our colleagues from Committee on Health, they are talking about varying funds for the purpose of recruiting most health workers, and they're urging government to recruit more. But they're not coming up with a figure and where there's also funds will come from. So this one becomes a problem to the committee.
Okay, thank you. Are you able to respond to those? You can start in whichever order you want to.
Thank you so much. Looking at one member here over the seeing other or exploring other avenues through which government can employ. That I'll make mention that we did not look at that. I just want to be as clear as that. Now, you may wish to take note that the recruitment of these health workers, the plan is there. And we are assured that the recruit 5,000 health workers and 24,000 community health workers is there and is clear, I think, in our report. That one is very clear, so we could not interrogate much because one, we're told yes, this one will be done. Coming to Honorable Smujisi, that one I would say we made request that certain programs should be varied, looking at those that are more critical. So what came out was we looked at ZAMUSA. ZAMUSA needs about 30 million for its to do the distribution and the like, and that actually we were assured that was considered. I think when we met the PS, who actually assured that this will be looked into, on a serious note. Otherwise, the chair can
the issue of branding. The question from
the issue of branding, I think the last time before we sat in our committee, we had a tour of ZAMSA, where I think personally I inquired in that, and we were shown packages written Republic of Zambia. So I can assure you that actually, if you go there, is something that you'll be able to tell looking at the packaging, GRZ. Okay. And I question as to why, because I joked, I said, most of this is coming from donors. Okay. So why do you want to align yourself as, I said, no, actually, even if it's coming from donors, but it's a property of the public, the Republic, so that one is actually done. I submit.
Thank you. One of the recommendations you have made is on the sin taxes. The government collects revenue through, say, taxing on tobacco, beer and spirits, even gambling, and I can see one Abochinkuli is laughing, betting, all those are called the sin taxes. Okay, it was on a lighter note. And those are called the sin taxes because of their nature. And you are recommending as a committee that such funds should strictly be like committed, or that these are direct earmarked for health expenditure. Now in doing the budget, if you do that, what's the ministry obviously will do plan, or they have the assessment of how much they think they can collect during the year under these taxes, like sin taxes, and I want to believe that they would, if it's the budget for health now, it's called billion, and under sin taxes maybe they are marking maybe to collect about 3 billion. Then they will net off, meaning from the other sources they'll say, okay, we'll give you say about 9 billion to make it 12. But have we also considered the other side, whereby you find these taxes usually sometimes you find they underperform in terms of what actually you collect, even as we recommended that. I don't know whether you had that in mind as we make these recommendations, that in an event that these taxes underperform, say maybe already now there is an issue in betting going on, where there are some, I saw something which is going around like betting companies, because of the increase to 10%, they are now considering pulling out. if that happens, have you considered the consequences of doing that? In fact, that it will have a direct impact on the on your budget. If you are to just critically say you want to get that, because currently whatever is collected, all of it goes to head 99, and from there the ministry now will allocate funds as and when they. But going to that route of to say, okay, all the sin taxes must part of the fund the health. I don't know whether you thought about that.
Okay, Chair, can I answer that one?
Honorable Dr. Kalila.
Yes, please.
Welcome. You can introduce yourself, sir. I know I've already called up your name.
Yeah, Chair, my name is Dr. Kalila, a member of this committee, and sorry for joining in late. I actually mixed up the dates.
Okay.
I wish I had started from the beginning. So basically, Chair, the problems of the health sector, we all know them, but one of them is underfunding. So there has been a debate and indeed a sustained discussion over time that we need to bolster domestic resource mobilization, and many suggestions have made. Chair, we have sat with you in various meetings, one of which worldwide has been a call to tax unhealthy habits like sin taxes. Now, what has happened to many jurisdictions is that the money collected for sin taxes is ring-fenced towards health. In our jurisdiction, as we saw last time, the money goes to Control 99, meaning that it's going to be used for various other sectors of the economy. What we are saying as a committee is that in order to have a bit more money, can we have all of that money go to health? We are aware that sometimes taxes underperform, but better you have a little than in this case where it's going all over. So that is the basis of this recommendation, that can we have these sin taxes directed towards the health sector, reinvest towards health, as opposed to the general vote of Control 99, where some of it will go to some other things unrelated to health. So that's the point, Chair.
Okay.
And it will be a contribution to the coffers of the health sector.
Okay. I feel you are not getting the question we are asking as a committee.
Yeah, the question you are asking is that have you ever considered that sometimes this tax may underperform? Any other tax
not only
pronounced by government. Not only.
Honorable Kalila,
make it clear, sir.
To make it clear, currently we are sitting at a budget for 2026 of 253 billion, isn't it?
Yes.
And out of that, the government has indicated the ways in which they want to raise that funds.
Yes.
And one of them is through the taxes.
Yes.
Where even the sin tax, I'm taking into account that even the sin tax are already part of the planning to say maybe under the tobacco taxes they are going to raise 1 billion, for example. So the question which we are asking as a committee is, assuming your budget or total budget is 12 billion for health,
yeah,
and out of the 12 billion, if you went that route to say all the monies which are collected through the sin tax are automatically directed towards the on the health. Okay, and from the 12 billion, maybe assuming the total which the ministries they are marking to collect, say, is 2 billion from the sin taxes.
Yes.
So meaning they would say, okay, we have this 2 billion, we only look for 10 billion from the other sources.
Yes.
To make it 12. But in an event that instead of collecting 2 billion, you collect 1 billion, meaning from whatever you get, then you have a short for 1 billion, isn't it? So that's where we are asking to say, is that your recommendation, or are you saying over and above whatever has been allocated to the ministry, said 12 billion, whatever is collected from the sin taxes becomes like a bonus?
Exactly. So
okay.
the point, Chair, is that sin taxes, apart from increasing revenue to the health sector, they also serve the purpose of discouraging those bad habits.
Okay.
And it's not only sin taxes which may underperform, even the other taxes may also underperform. But the point is, what we are begging as a health sector is that please, that money direct it to us,
okay,
above what we are getting.
Okay.
Yeah.
That's what I want to make clear. Honorable members, any other questions? Honorable Chitalo, Dr. Chitalo.
Thank you very much. Let me begin by contributing to the debate on the sin taxes. Sin taxes were introduced in 2017 as a measure to increase revenue for the health sector. And the Minister of Finance did introduce that sin tax. It was part of the budget submission from the Minister of Health. However, that money has just never gone to the Minister of Health, despite it having come as a budget contribution from the Minister of Health. I support the committee in its submission that that resource goes to the Minister of Health. It's part of sustainable financing for healthcare. And in addition to what Honorable Kalila said, Chair, why we call them sin taxes, we say for the sin of smoking and for the sin of consuming sugar drinks,
Okay.
for the sin of consuming sugary drinks, that will cause diabetes, that will cause obesity, and hypertension. Look, why don't we extract some money from you? So we are saying we are discouraging bad habits that contribute to non-communicable diseases. At the same time, we're using that revenue to combat the same non-communicable diseases in terms of health promotion and disease prevention. I'll get back to the question I asked earlier on, if you permit me, Chair.
Yes.
It is expected that the budget will translate some of the policy statements in the State of the Nation address by the President, and the President did allude to the fact that his statement of intent in the health sector was to attain universal health coverage. The Minister of Finance did state that too, but the budget itself doesn't resonate to that intention. Number one, we see a reduction in the budget. Number two, even in the face of fiscal consolidation, it is expected that the health sector, as a critical social service, should be spared. But number two, we also know that competing for resources from Treasury is not the most sustainable way to finance healthcare. Globally, it is known that healthcare financing, which is a critical component of universal health coverage, requires that you invest in a robust, resilient, and sustainable healthcare financing system. Zambia started well with NIMA, and over the years, milestones have been scored, and all that has been required has been to ensure that we maintain building on what has been scored as a success. If you look at where we started from, where it is today, you could see that actually this is a very promising and sustainable way of raising resources for the health sector. We do not see the aggression from the health sector budget to reinvigorate NIMA and let it be a tool to provide healthcare financing as a critical component for universal health coverage, and also to provide relief on Treasury. So why won't we see the health sector budget deliberately pitch healthcare financing, and in particular NIMA, as a robust way to sustain the intention for the government to achieve universal health coverage, in addition to the sin taxes?
Okay.
Thank you.
Chair, can I answer that one?
Your Vice Chair has to give you that permission, sir.
You can go ahead.
Okay. Permission given, you can go ahead.
Okay, so Chair of the Expanded Committee and colleagues in the room, first and foremost, it is true what my colleague Honorable Chinufya is talking about, but I must hasten to quickly add that this committee had realized that a very long time ago that number one, you need more money for health, but two, national budgets are limited, and you cannot solely rely on the fiscals to fund the entire budget to the tune of 15% of the budget declaration.
Honorable Dr. Halila, the point of order has been raised. Honorable members.
Honorable Chair, apologies to disturb my older brother, Honorable Kalila. Chairman, I just want to find out. I was about to make a submission earlier for my committee, and I was not allowed, being the chair. So is the honorable on the floor, who's the chairperson of this committee?
No, he's not.
Honorable Mwambazi, Honorable Kalila is no longer a chairperson.
Is
the
it?
chairperson for health is Honorable Musanja.
Ah, okay. Apologies.
I'm no longer.
Thank you.
Yeah, that's why I've been allowed.
Okay.
So I was wondering if his chair has got a selective way
No,
of
no.
doing things.
Yeah.
No, that's why.
Thank you for the guidance. Yeah.
Thank you.
Yeah. Yeah, but anyway, to answer the question in short, is that this committee realizes extremely the importance of a robust health care financing system, and it made a strong case for NIMA to be resuscitated. A very strong case to the Ministry of Health team to take interest in NIMA, to actually increase funding to NIMA, to do so many things so that the ministry can have another way of putting money in the kitty. If you notice, last year, through the effort of this committee, we proposed that NIMA should be given 230 million. Unfortunately, we only got 1.5. This year, we have repeated, and we did repeat to the entire team. I think we managed only, so far, if I recall, probably 3 point something million, which is still very little. So, what Honorable Chilusha is saying is what the committee also has been saying, and all of us know the importance of ensuring that we keep NIMA afloat, of ensuring that we go back to the basics, including what the actuarial studies that it set up said, that we actually need to increase contributions. All these things we mentioned, apart from, of course, the sin taxes which we're talking about. And we will continue to suggest several other ways of financing health, because we know the fiscus is not enough.
Okay.
Unfortunately, we never got exactly what we wanted. Isn't it, Vice Chair?
Okay.
That's true.
We didn't get what we wanted, but we challenged the team at Make House and everybody else to begin to see this as the only sustainable way of bringing in money in the healthcare. Okay. Well, people said, well, there's CDF, there's also money in the defense, there's money in other sectors of the economy, so I think we'll manage. Their partners still here and there. So that's the way I could answer your question, Honorable Chilusha.
Okay.
Yeah.
Okay.
Thank you.
Thank you very much, honorable members. We have to end here, unless if there's any burning questions. Nothing. We want to comment, Honorable Vice Chairperson?
No, it's Honorable Chinguli who wants to say something.
Okay, Honorable Chinguli.
Thank you so much. In relation to NIMA, what is coming up is NIMA collects, I'll give you in figure terms, about 110, but spends 170. So already you see that we are ever in the deficit. So now they have given us a budget of 2.7 million, and we propose that can we have a 5.3 million, of which that has been agreed, and the government is has agreed that will be given this 5.3 million, and I think on NIMA operations we are somehow reaching what needs to be attained. I submit.
Thank you. Okay, honorable members, we end here. Vice Chairperson with your team from the Committee on Health, thank you for taking us through those two heads. This committee do appreciate. We are meeting the Finance Minister, I think, on Thursday next week. These recommendations will be taken into account. Thank you once again for coming. Thank you.
Thank you very much, Chair, and honorable members. Thank you.
Thank you.
Thank you so much. You are still watching Parliament TV, the only station dedicated to bringing Parliament closer to you. Remember, on 26th September 2025, Finance and the National Planning Minister, Dr. Stumbeko Msokotwani, did present the 2026 National Budget. After presentation of the 2026 budget, the sitting of the House was suspended for 20 days, and estimates stood referred to respective committees for detailed consideration. So for the last 10 days, different committees have been receiving submissions from different stakeholders, and starting today, which is the 13th of October 2025, The expanded planning and budgeting committee is now receiving submissions from different committees which were sitting in the last 10 days. And we just had a committee on health, community development and social services, which appeared before the committee. We still have a lot in stock for you, so please don't touch that dial. Stay glued to Parliament TV as we continue to bring in Parliament closer to you. I've been your presenter for this session. My name is Akatama Myundajo, and of course my sign language interpreter, Jason Manda and Chola Kaoma. Good afternoon.